Hi there, my name is Dr. Greg Nute. I'm a licensed clinical Christian psychologist as well as a licensed mental health counselor and a registered play therapist supervisor. And I've been working in this field for about 20 years, and I've worked with pretty much every age group, children, adolescents, adults, couples, families. I really enjoy what I do. I love what I do, actually. I really see it as a way for me to kind of give back and help those that are hurting and in need. And so I appreciate you being here to interview me and talk about dissociative identity disorder. So dissociative identity disorder used to be called multiple personality disorder, but they've found that that's not as accurate as it should be, because it is actually a dissociation from your personality. It's a fractured self. So if there's a horrific trauma that happened earlier in life, it's actually a defense mechanism that the personality does. It fractures itself so that it can cope with things in their life. And the interesting thing about it is the personalities themselves have their own, they could have their own sex, their own age, their own gender. It really doesn't matter. But dissociative identity disorder is a difficult one to diagnose per se, because a lot of times it looks like other diagnoses. It could look like borderline personality disorder. It could look like bipolar. You have depression, you have anxiety, you have PTSD, in fact, has some dissociative qualities in it. That's post-traumatic stress disorder. So DID is one that really is a function of the self that really tries to help them to function in society. So some of the warning signs for dissociative identity disorder, like I said earlier, you've got an extreme amount of anxiety, you've got depression, you've got possible suicidal tendencies, ideation. Those are certainly not good. There's also some things like depersonalization, where they feel like they're kind of outside of their body. There's where they maybe feel like things aren't real, and it's kind of that derealization part. The amnesia, of course, is the big one, and that amnesia actually goes beyond just normal forgetfulness. It's I never said that before. I don't remember ever saying that. No, I didn't have that conversation with you. I don't know what you're talking about. There's that as well. There's also identity confusion, not really knowing who you are. That can pop up in a number of different ways. Switching. If you ever noticed anybody that switched personalities, maybe they were fine one minute in terms of they were just normal talking to you, and all of a sudden they switched and they were focused on some sort of religious preoccupation or some sort of orientation issue, or maybe they were talking about something else that had totally related to, or maybe you saw them come in and cringe all of a sudden for no reason. It's because of that switching part, where they are now switching into another person, which I said before could be any age, any race, any gender, either one. Those are certainly some warning signs for dissociative identity disorder. So misdiagnosis could be quite common, possibly. I know that dissociative identity disorder is only between 0.01% to 1% of the population, but it could be because it's misdiagnosed as something else. I think part of the difficulty is if you look at the criteria of DID, you've got to have two distinct personalities at least, which normally there's anywhere from 13 to 15. It could be 9. There's been as much as 100, which is quite a bit. But I think that if you look at, like, say for instance, schizophrenia, you have a lot of voices that you hear, but it's totally separate from an identity, because with schizophrenia, you're hearing voices in your head, or schizoaffective disorder, it's the voices that you're hearing, auditory hallucinations, those types of things. But with DID, it's actually personalities that are different and distinct. And typically there is a lot of distress with the person that has DID they don't really know what's going on because when they split, that other one takes over. And so there is a distinction between that and schizophrenia. Another diagnosis that could be possibly, which I mentioned before, was borderline personality disorder. Also post-traumatic stress disorder. There is some dissociative aspects of that, but there's not any changing of identities. And even in borderline, there's really not a change in identities, it's just a switch. That's usually associated with bipolar. Bipolar and borderline can get confused as well. But overall, dissociative identity disorder, even though it's a rare thing, I would postulate that I think that there's probably a lot more out there that have DID that are misdiagnosed just because of people that have that severe trauma, and then there is that fracturing that happens in the identities. So some of the ways friends and family can actually help, again, going back to depression, the anxiety, suicidal ideation, and even sometimes there'll be drug abuse or drug use. If you talk to them about maybe seeking professional help in those areas, whether it be with their depression, their anxiety, that's getting them into the door so that a professional can actually help them. Of course, if you say, I think you have multiple personalities, you need to go see somebody, it's probably not the best way to go about doing it. But focusing on some of the other issues that maybe they're dealing with, those are some good ways to help. And in terms of their treatment, cognitive behavioral therapy is very effective with them, where you're actually helping them to kind of change their cognitive scripts. The goal actually is to help kind of put back their fractured self. It's kind of like a puzzle. You're putting back the pieces to help them become a whole person again. And so that would be that would probably be the best way to go about doing it, is by focusing on some of the other symptoms, like the depression or the anxiety or those things, because they may not even know that they're doing what they're doing, that they are splitting. They may not even have any idea. So that would be the best way to go about as far as friends and family go, because you really want to care for them, and you really want them to get better, and so focusing on those would be the best.